availability of respite care almost triples a palliative care patient's chance of dying at home. Okay, guys, that's the headline. Here we go. Here's B for you. Discussion B. The phrase availability of respite care almost triples a palliative care patient's chance of dying at home encapsulates a striking and emotionally resonant finding. When caregivers are supported through structured relief services, patients are far more likely to spend their final days in the comfort of their own homes. This isn't just a matter of convenience, it's about dignity, autonomy, and honoring deeply personal wishes. The headline draws from a robust Quebec based study that examined thousands of palliative care cases, revealing that respite care isn't a peripheral service. It's a cornerstone of establishing home based end of life care. Why dying at home matters. For many people, dying at home represents a final act of agency, surrounded by loved ones, familiar objects, and the rhythms of daily life. Yet, despite this preference, institutional deaths remain the norm in many regions. The reasons are complex. Caregiver burnout, lack of home based medical support, financial and logistical barriers. Respite care addresses these challenges head on by giving caregivers the chance to rest, regroup, and receive professional backup. It creates it creates the conditions under which home deaths become not just possible but sustainable. What respite care looks like in practice. Respite care is flexible and multifaceted. It can be tailored to the needs of both the patient and the caregiver. In home services, nurses, aides, or volunteers who provide temporary care. Facility based stays, short term admissions to hospice or care centers, scheduled relief assistance with daily tasks like bathing, feeding, or administering medications. These interventions don't replace the caregiver's role, they reinforce it. They allow families to continue caring without collapsing under the weight of exhaustion, grief, and logistical strain. The Quebec study, what makes it so compelling? Researchers in Quebec analyzed data from over 14,000 patients receiving home-based palliative care. They looked at which factors predicted whether patients died at home versus in hospitals or long-term care facilities. The standout finding: patients whose caregivers accessed respite care were nearly 3 times more likely to die at home. This effect held even after adjusting for income, disease severity, urban or rural location, and other vulnerabilities. The study used advanced statistical modeling to isolate the impact of respite care from other confounding factors. This wasn't incidental. It was a rigorously quantified insight with clear implications for policy and practice. Other services that support home deaths. Respite care is part of a broader ecosystem of supports that make dying at home feasible. Access to skilled nursing and palliative care teams, help with hygiene and personal care, effective pain and symptom management, 24/7 on-call support for crises or emergencies. Together, these services form a safety net that allows patients to remain in their homes with dignity and comfort. Implications for health systems and policy. Okay, in Quebec, only about 30% of people die at home, lower than the national average. Yet surveys consistently show that most Canadians prefer to die at home. This disconnects points to systematic gaps, caregiver fatigue, and lack of support, inadequate home care infrastructure, unequal access to services based on geography and income. The study's findings offer a clear path forward. Investing in respite care can dramatically increase the likelihood of home deaths. For policymakers, this means embedding respite care into standard palliative care packages, finding caregiver support programs, ensuring equitable access across urban, rural, and underserved communities. Reading the headline with nonsense. While the headline is 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 powerful, it simplifies a complex reality. Key caveats include the effect size varies depending on how respite care is defined and delivered. The study is observational, so while it controls for many vulnerabilities, it doesn't provide casualty media summaries. Many gloss over methodology details or oversight certainty for those designing interventions or evaluating outcomes. It's worth consulting the full study to understand the scope, limitations, and definitions. Ultimately, this finding reframes how we think about end-of-life care. It shifts the focus from clinical settings to community-based support, from institutional effectiveness to human dignity. Respite care isn't just a service, it's a catalyst for honoring the wishes of patients and sustaining the people who love them. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. Have a good evening.